Hello guys, welcome back to the Unacademy NEET PG live channel. I am Dr. Himanshu Gupta and I have done my MBBS and MD from Maulana Medical College. So guys, in this short session, we are going to discuss few MCQs in radiology, right? So guys, I have few MCQs from the section of GA radiology, from chest radiology, and we are going to have a very good session for another 1 hour. Okay, so before we begin, let us wait for a few more students to join, and then we can begin with the session, right? So start करते हैं. So students are there with us. So guys, I want to know from you, how many of you are there on the Unacademy learning app? How many of you are there on the Unacademy learning app? Good evening, Shrasti. Good evening, Esma. So guys, on the Unacademy learning app, okay, I take fast revision sessions. Okay, at 11 p.m. Okay, where I discuss important questions from every subject. So, okay, great. Okay, so I would definitely ask you guys that you download the Unacademy learning app. That you don't download the Unacademy learning app. Follow me there, and so that you get a notification as soon as I will post my lecture. Right? So a child has respiratory distress. Chest X-ray shows multiple air-filled spaces. The differential diagnosis is all except. The differential diagnosis is all except. So, Dr. Ravi Raj, you can go for the iconic subscription, okay, in which you will get both of prep ladder as well as Unacademy. You will get both of prep ladder as well as Unacademy. Okay, so I think that is a better subscription. That is a good subscription. So you don't have to worry. Okay, and you get the experience of so many teachers when you go for the iconic subscription, right? So guys, I also want to tell you that there is one discount that is coming up. Okay, you can use my code Dr Himanshu Live. Dr Himanshu Live. You can use this code and you can avail an additional 20% discount. 20% discount with this code. Okay, so that is ओके ग्रेट. देख लेंगे तो सब कुछ आता है. ठीक है, अमेजिंग देख लेंगे. तो गाइस, सिस्टिक लीजन, ओके, वेरी गुड आंसर्स बाय शास्त्री कतियार एंड देख लेंगे. So cystic lesions, multiple air-filled spaces. Okay, these include your congenital lung cyst, congenital diaphragmatic hernia, and congenital adenomatous malformation. ठीक है. So as far as lobar aplasia of the lung is concerned, guys, you will get a homogeneous opacity. You will not get multiple air-filled spaces in patients with congenital lobar aplasia, right? Then guys, this is an x-ray. This is an x-ray of the neonate, okay, and the neonate presented with respiratory distress. So guys, what are your differentials and what are your imaging findings? What are your observations for this x-ray? What are your observations for this x-ray? Sunburst appearance? No. Tell me guys. Tell me guys. Child presented with unit presented with respiratory distress. ठीक है. Very good, Shrasti Katyar. So that is a very important differential, that is lobar consolidation. ठीक है. You are seeing homogeneous opacity in the left lower lobe, homogeneous opacity in the left lower lobe, and but guys, in this image there are other features also which you need to see. Okay, so these features, these include, just hold on. So guys, there is some homogeneous opacity in the left lower lobe. Okay, no. So guys, what is happening in this image, what is happening in this x-ray? There is contralateral expansion of the right lung. Okay, and if you just have a look at the bronchi, you will see left bronchi is not visualized. In this image. Left bronchi is not visualized in this image. Okay, so this was a case of congenital lobar aplasia of the lung. Okay, homogeneous opacity in left lung, contralateral expansion of the right lung. Okay, so these are important features of congenital lobar aplasia of the lung. Yes, as far as lobar collapse is concerned, that is an important differential of the congenital lobar aplasia of the lung. Okay, very good. Moving on to the next image. Guys, what do you see in this image? Your name is very good. देख लेंगे. What are your observations? Directly coming to a diagnosis. So guys, in this image you are seeing that there are multiple ठीक है, cystic. Yes, very good, देख लेंगे. Multiple cystic spaces are seen in the right lung. Okay, so I told you few differentials. Okay, one of the two differentials that are very important in this image. One is your CCAM, okay, congenital cystic adenomatoid malformation, and the second differential is your congenital diaphragmatic hernia. Okay, so guys, today I will tell you how you are going to differentiate congenital diaphragmatic hernia and your CCAM. How do we differentiate both of these? So guys, you will look at the position of the trachea. Okay? If the trachea is central in position, it means there is no mediastinal shift. It means that is the case of CCAM. If the trachea is deviated to the opposite side, then guys, you will think that it is a case of congenital diaphragmatic hernia. Clear है सबको? जब herniation होगी bowel lobes की, that will shift the mediastinum to the opposite side. That is not happening in this case. ठीक है? That is not happening in this case. Right guys? Clear है? Is everyone clear with this image? Great. ठीक है, so inferior rib notching is seen in very good, Shrasti, Subhash, Rijo, Alex. So, guys, inferior rib notching, it is seen in your coarctation of aorta, right? So, guys, what is the reason? What is the reason for this development of inferior rib notching? What is the reason? What is the reason for the development of inferior rib notching? Very good, Shrasti Katyar. So, guys, I will tell you what is the reason. What is the reason why this inferior rib notching occurs? Guys, in coarctation of aorta, your blood supply to the descending thoracic aorta, it decreases. Blood supply to the descending thoracic aorta decreases. So in order to compensate for the decrease in blood supply to the descending thoracic aorta, guys, what happens? Blood from the subclavian artery, then to the internal mammary artery, then to the anterior intercostal arteries, which are rib notching, other cause notching. Can you tell me what are the other causes? Other causes. So other causes of inferior rib notching, these include your SVC obstruction, either I am having a bad internet connection or you are having. ठीक है? So guys, other causes of inferior rib notching, these include your SVC obstruction, then you have your arteriovenous malformation. Okay, yes, all the shunts, Blalock-Taussig shunt. Okay, they can also result in inferior rib notching. ठीक है? So guys, tell me what are the question is, all are seen in congestive heart failure except all are seen in congestive heart failure except all are seen in congestive heart failure except curvy B lines, prominent lower lobe vessels, ठीक है? Pleural effusions, cardiomegaly. Very good. All of you are getting it right. So guys, all are seen in congestive heart failure. Except prominent lower lobe vessels. Okay, so you are going to see prominent upper lobe vessels. So guys, what happens in congestive heart failure? ठीक है? Because your heart is not able to pump blood, okay, your pressure in the pulmonary veins start increasing. When the pressure in the pulmonary veins and pulmonary arteries, okay, they will start increasing, what will happen, because of increased hydrostatic pressure, it will result in interstitial edema. In the lung. So because of this interstitial edema, okay, this interstitial edema appear as interlobular septal thickening. It appear as interlobular septal thickening on CT. Whereas on chest X-ray, this appear as Curley B lines. ठीक है? This appear as Curley B lines. So Curley B lines are nothing. These are parallel lines. These are perpendicular lines to the pleura. Okay, approximately 1 mm in thickness, 1 mm in thickness, and 1 centimeter, 1 to 2 centimeter in length. ठीक है, so these are your Curley A lines, Curley B lines. Pleural effusion, okay, first interstitial edema will develop, okay, and then gradually the fluid will start leaking into the pleural cavity, okay. This will result in pleural effusions and cardiomegaly तो होगा ही. Egg on side appearance of heart is seen in. Egg on side appearance of heart is seen in. Egg on side appearance of heart is seen in. Very good. ठीक है. So all of you have given the right answer. All of you have given the right answer. So guys, egg on side appearance. Egg on side appearance. It is seen in transposition of great arteries. Transposition of great arteries. So what happens in transposition of great arteries? Okay, your aorta will arise from the right ventricle, and your pulmonary arteries, they are going to arise from the left ventricle. ठीक है. In total anomalous pulmonary venous connection, what is going to happen? Very good, very good. Okay, you are going to get a snowman appearance. Snowman appearance. Okay, can anyone tell me? Can anyone tell me what is partial anomalous pulmonary venous connection? What is partial anomalous pulmonary venous connection? Anyone who can tell me what is partial anomalous pulmonary venous connection? What is partial anomalous pulmonary venous connection? Yes, very good answers by Rijo and Dr. देख लेंगे. ठीक है. So guys, what happens in partial anomalous pulmonary venous connection? Okay, in TAPVC, all the veins, all the pulmonary veins, they were either draining into SVC, or they were draining into IVC, okay, or they were draining into the right atrium. But in partial anomalous pulmonary venous connection, few of the veins will drain into the right atrium, and few of the veins will drain into the left atrium. So this is what you understand by the term partial anomalous pulmonary venous connection. Partial anomalous pulmonary venous connection. ठीक है. Now guys, tell me, Tetralogy of Fallot. Tetralogy of Fallot. What is the appearance that you are going to get in Tetralogy of Fallot? What is the appearance that you are going to get? No special sign for PABVC. ठीक है. Very good, very good. ठीक है. आपको Tetralogy of Fallot में you are going to get boot shaped heart. You are going to get boot shaped heart. ठीक है. And what are the other features? What are the other features that you are going to see? Boot shaped heart. What are the other features that you are going to see? So guys, other features that you are going to see in Tetralogy of Fallot. Okay, So because we will do it stepwise. So guys, first, pulmonary stenosis will develop. Okay, when there will be pulmonary valve stenosis or infundibular valve stenosis, what will happen? It will result in increased pressure. Come on, guys, tell me what is the meaning of the term? What is the meaning of the term overriding of aorta? So, guys, overriding of aorta means that your overriding of aorta means that your is there any problem with the connection? Any problem with the connection? So, guys, overriding of aorta means that your aorta, it is going to arise from both the right ventricle as well as right left ventricle. Aorta is going to arise from both the right ventricle and left ventricle. ठीक है? So this is what you understand by the term overriding of aorta. Overriding of aorta. So let me just make an image for you guys. ठीक है? So if this is your ventricles, these are your ventricles. ठीक है? If these are your ventricles, clear? Let me just draw it for you. If these are your ventricles, ठीक है? ये आपका ventricle है. One is your right ventricle, one is your left ventricle. Okay, this is your left ventricle, this is your right ventricle. So guys, normally what happens in a patient, okay, in a normal patient, your aorta, it is going to arise from the left ventricle. But in patients with tetralogy of Fallot, what is going to happen? Your aorta, it is going to arise from both the both the both the right ventricle and left ventricle. Aorta is going to arise from both the right ventricle and left ventricle. This is what we understand by the term overriding of aorta. Okay. So guys, whenever this overriding of aorta, it is it is more than 90%. Overriding of aorta is more than 90%, guys. What is the term that we are going to use when the overriding of aorta is more than 90%? If the overriding of aorta is more than 90%, what is the term that we are going to use? Anyone? So guys, in that case, we are going to use the term double double outlet double outlet right ventricle, double outlet right ventricle. If the overriding of aorta is more than 90%, ठीक है? So guys, coming on to the next chest X-ray. ठीक है? A patient presented with dyspnea. Okay, chest X-ray was done. Okay, What do you see? What do you see in this chest X-ray? What do you see in this chest X-ray? Anyone? What do you see in this chest X-ray? What do you see in this chest X-ray? Anyone? So guys, in this chest X-ray, what we see? What we see that your cardiothoracic ratio. Cardiothoracic ratio. Okay. Yes, the ratio of the heart. Okay, the ratio of the heart to the ratio of the thoracic cavity is more than 50%. Cardiomegaly is present. Cardiomegaly is present in this patient. Okay. Along with cardiomegaly, what are the other features? You are seeing that there are prominent upper lobe vessels. Prominent upper lobe vessels that you are seeing in this image. Okay. So this was the case of congestive heart failure. Congestive heart failure. Right? This was the case of congestive heart failure. Best radiography for pleural effusion is best radiography for pleural effusion is best radiography for pleural effusion is lateral view, AP view, PA view, lateral decubitus view. Which is the best radiograph? Very good, Julie. Julie Brizzy. So, guys, the best radiograph for pleural effusion is your lateral decubitus view. Lateral decubitus view. Okay. So, guys, what is the sign? What is the sign that you are going to get in a PA view? Okay. What is the sign that you are going to get on chest X-ray in PA view in case of pleural effusion? The sign that you are going to get in PA view on chest X-ray, chest X-ray, what sign you are going to get in case of pleural effusion, guys? Anyone? Very good. Not obliteration. Okay. We will say that there is blunting of CP angle. Okay. Blunting of CP angle. And how much fluid is needed? How much fluid is needed to cause blunting of CP angle? How much fluid is needed to cause blunting of CP angle? How much pleural effusion has to be there that will result in blunting of the CP angle? No, not 30 ml. So it has to be around 200 to 300 ml. 200 to 300 ml. That will the structure marked in the image below. So only 1% is giving the right answer. So the structure that has been marked in the given image, it is your ascending aorta. ठीक है, ascending aorta is marked in this given image. Can you tell me what is this structure? What is this structure that has been marked in this image? What is this structure that has been marked in this image? Anyone? What is the structure marked as being in this image? Come on, guys. बताइए. Very good, Ritu. B is your pulmonary artery. Okay, the structure marked as B is your pulmonary artery. ठीक है, and the structure that is marked as C in this image. C कौन सा structure है बताइए. Which is the structure marked as C in this image? C कौन सा structure है यार? जो येलो में स्ट्रक्चर मार्क करा है, द स्ट्रक्चर मार्क इन द येलो दैट वी हैव ऑलरेडी डिस्कस्ड. ठीक है, इट इज योर असेंडिंग एओर्टा. नाउ आई एम आस्किंग यू स्ट्रक्चर मार्क्ड एज डी, स्ट्रक्चर मार्क्ड एज सी इन दिस इमेज. सी कौन सा स्ट्रक्चर है? B also we have discussed, it is your ascending aorta. Which is the structure that is marked as very good Shastri Katyar. Okay, the structure marked as C in this image, it is your descending thoracic aorta. Right? Good. Identify the condition shown in the below X-ray image. Identify the condition shown in the below X-ray image. Identify the condition shown in the below X-ray image. Very good, very good. So Rijo has given the right answer. Rijo Julie. Okay, you guys have given the right answer. So guys, in dextrocardia, you will see that your heart is pointing towards the right. Okay, cardiac apex is pointing towards right. In case of dextrocardia, okay. In this case also, your cardiac apex, it is pointing towards the right. But guys, what else you can see in this image? Okay, there is malposition of the visceral organs as well. Okay, so your liver, it is usually situated on the right side, but in this image we can see your liver it is placed on the left side of the abdominal cavity. Your liver is placed on the left side of the abdominal cavity. ठीक है, that is why this is a case of dextrocardia with situs inversus totalis. Okay, so whenever this kind of question is given in your NEET PG exam or your FMG exam, okay, always have a look at the position of the funding bubble or your position of the liver. Okay, if it is reversed, then you will label it as a case of situs inversus totalis. Characteristic X-ray finding in ASD is come on guys. Characteristic X-ray finding in ASD is enlarged left ventricle, enlarged left atria, pulmonary plethora, pulmonary artery hypertension. Very good. ठीक है. So guys, characteristic X-ray finding in ASD is, so guys, what happens in ASD? Okay, so there is connection between your left atrium and right atrium. Okay, so blood will flow from the left atrium to the right atrium, take a left to right shunt, then blood will go to the right ventricle, and from there to the pulmonary arteries, pulmonary veins, then again to the left atrium. So guys, what happens, your blood flow to the lungs increases. So whenever there is increased blood flow to the lungs, it will result in pulmonary plethora. Okay, so and pulmonary oligemia we discussed, it is present in Tetralogy of Fallot. So because of constriction of the uh, pulmonary artery, okay, there is decreased blood flow to the lungs. Okay, and that results in pulmonary oligemia. ठीक है. So guys, this is a case of VSD. Okay, in which what was happening, there was increased blood flow to the lungs, and it was resulting in pulmonary plethora. ठीक है, टॉफ का केस नहीं है. This was case of VSD. Which of the following is not a cause of an elevated dome of the diaphragm? So guys, this question was recently asked in your NEET PG 2022. 2021. ठीक है. A question on the elevated dome of the diaphragm. Okay, a chest X-ray was shown. A chest X-ray was shown in which your dome of diaphragm, one dome of diaphragm was elevated. So, okay, and some history was given of trauma in that patient. Some history of trauma was given in that patient. So, guys, which of the following is not a cause of the elevated dome of diaphragm? Elevated dome of diaphragm. Diaphragmatic paralysis, pulmonary and lobar collapse, subphrenic abscess. Subphrenic abscess. Anyone? Very good, very good, very good. ठीक है. So guys, in case of pleural effusion, okay, your diaphragm may look elevated. Okay, your diaphragm may look elevated, but it is not a cause. It is not a cause for the elevation of the diaphragm. ठीक है. In that case, you are also going to see blunting of the CP angles. Blunting of the CP angles. Okay, can you guys tell me one kind of pleural effusion in which you will not see blunting of CP angle, and in which the highest point of the dome of the diaphragm, it shifts laterally. Highest point of the dome of diaphragm, it shifts laterally. Anyone? A kind of pleural effusion in which you are not going to see blunting of the CP angle, and in which the highest point of the dome of diaphragm, it is going to shift laterally. Guys, which is that case? No. Highest point of the dome of the diaphragm, it shifts laterally. So guys, that is the case of subpulmonic pleural effusion. Write down this word, subpulmonic pleural effusion. Okay. So what happens in subpulmonic pleural effusion? ठीक है. If this is your lung, and this is your diaphragmatic pleura, ठीक है, fluid will collect between the lung and the pleura, but it will not result in blunting of the CP angle. ठीक है, right? And guys, tell me phantom tumor is going phantom tumor is seen in phantom tumor, you are going to see in which case you are going to see a phantom tumor. इस केस में the answer of the question is large pleural effusion. ठीक है. Subphrenic abscess will also push the diaphragm upwards. Okay, diaphragmatic paralysis also, diaphragm will be pushed upwards. Lobar collapse also. Okay, in lobar collapse, what will happen? Okay, it will push the diaphragm towards itself. Very good. Okay, in phantom tumors, there is fluid collection in the fissure, ठीक है, horizontal fissure. And what happens after the patient has been treated with diuretics? In a case with congestive heart failure, patient has been treated with diuretics, this loculated effusion, it disappears. ठीक है. So that is a case of phantom tumor. A patient is having mitral stenosis. His X-ray will show all of the following except. Lifting up of left bronchus, double atrial shadow, oligemia of upper lung field, posterior displacement of esophagus on barium. A patient is having mitral stenosis. His X-ray will show all the following except. Come on, guys. What is your answer? I want every one of you to take part in the discussion. I want every one of you to take part in the discussion. Very good, Ruksar. Very good, Shrasti. Anyone else who would like to attempt this question? Very good, Rejo. Amazing, amazing. Okay. So, guys, these are important signs of the mitral stenosis, which you should be aware. So, guys, the first sign is your widening of the carinal angle. Okay, widening of the carinal angle. Then you are going to see double atrial shadow, as you can see in this image. Okay, okay, double atrial shadow. Very good. Birudha. Okay, very good, Birudha. Okay, pulmonary plethora will be there. Okay, there will be widening of the carinal angle. There will be uh, double atrial shadow will be seen. Double atrial shadow will be seen. Okay, and you are going to see straightening of the left heart border. So, guys, I will tell you what happens. Why do you see a straightened left heart border? Okay, sorry, why do you see double lateral shadow? So, guys, normally, okay, if this is your atria, okay, this is your heart. Okay, you take a chest x-ray. X-rays travel, okay, from the posterior to the anterior direction, or anterior to the posterior direction. Okay, both the borders of the heart. Okay, uh, the borders of the right atrium as well as border of the left atrium. Okay, they are lying side by side. But, guys, what happens when there is dilated left atrium? When there is dilated left atrium, okay, your left atrium, okay, the border of the left atrium, it is seen. The right border of the left atrium, it is seen separately. Border of the Please let me know if you are able to understand this thing. Okay, the border of the left atrium, it is seen separately in case of dilated left atrium. When this border of this left atrium is seen separately, it results in the formation of double atrial shadow. Okay, how many of you guys can appreciate the double atrial shadow in this image? How many of you guys can appreciate the double atrial shadow in this image? Okay. ठीक है? Clear? The following is not a differential diagnosis. The following is not a differential diagnosis of an anterior mediastinal mass. The following is not a differential diagnosis of an anterior mediastinal mass. Great. The following is not a differential diagnosis of an anterior mediastinal mass. Very good, Shrasti, Rijo, Julia. Okay, the answer is Basant, Basant Adi. Okay, what is neurogenic tumor? Very good question. Okay, so neurogenic tumor is any tumor that is arising from the nerves, that is arising from the nerves. Okay. So guys, if you talk about the mediastinum, okay, in mediastinum, mostly the nerves, these are arising from the nerves, okay. These neurogenic tumors arise from the spinal nerves, okay. And the spinal nerves arise on either side of the vertebra, okay, on either side of the vertebra through the neural foramina. These nerves are going to arise, okay. And within these nerves you can have various tumors like your neurofibroma, which you must have heard, okay, neurofibroma. Then your schwannoma, okay. All these tumors, these are arising from the spinal nerves, right? All these tumors are arising from the spinal nerves, and these are mostly found in the posterior mediastinum, ठीक है. ठीक है, these are mostly found in the posterior mediastinum. So guys, we should also know what are the lesions that we are going to find, what are the lesions that we are going to find on the lesions that we are going to see in the anterior mediastinum, okay. Which are the lesions which we are going to see in the anterior mediastinum? What is the mnemonic to remember the lesions in the anterior mediastinum? Anyone? What is the mnemonic to remember the lesions in the anterior mediastinum? So guys, the lesions in the anterior mediastinum, they can be remembered the simple mnemonic 4 T's. Okay, so these 4 T's include your thymoma, thymoma. Then you have terrible lymphoma, terrible lymphoma. ठीक है. Then you have your thyroid mass, and last you have your teratoma, okay. Remember these lesions arise from the anterior mediastinum, ठीक है. And guys, teratoma, how do you identify a teratoma? How do you identify a teratoma on a CT image? Guys, on a CT image you are going to see fat attenuation contents. And guys, fat attenuation contents look black, ठीक है. Then you are going to see calcific components, and calcific components, they will appear hyperdense, ठीक है. And last you will also see fluid components within the lesion, which will appear as hypodense structure, ठीक है. So this is how you are going to identify a teratoma, ठीक है. Now moving on to this x-ray. Guys, tell me, what are your imaging findings for this chest x-ray? What are your imaging findings for this chest x-ray? First one. Anyone who would like to give the answer? Your imaging findings for the first X-ray. Come on, guys. वेरी गुड, देख लेंगे। बहुत टाइम बाद दिखे हो आप, कहाँ गायब हो गए थे? So guys, in the first x-ray we can see that there is some homogeneous opacity in the right lung field, homogeneous opacity in the right lung field, okay, in the retrocardiac area, ठीक है? So this was a case of left lower lobe, this was a case of left lower lobe collapse, right? And talking about the second image, what we can see, in the second image, you know, there the lung fields are hyperinflated. But this is not the finding that I wanted to discuss. Guys, we can see that there is some homogeneous opacity in the left upper lobe, okay, homogeneous opacity in the left upper lobe. And you can also see sickle shaped air can be seen around the arch of aorta, ठीक है? So guys, this is what is known as Luftschichel sign, ठीक है? Seen in a patient with left upper lobe collapse, ठीक है? Moving on to the next image, guys. What are your findings? What are your findings for this chest X-ray? Very good, Shastri. Very good, Shastri. Amazing, guys, amazing. Very good. Okay, so guys, in this cavity formation, you are seeing, in this pre-existing cavity, okay, you are seeing formation of fungal ball, okay. This is known as monod sign, ठीक है? monod sign, ठीक है? seen in patients with aspergillosis, ठीक है? Not okay, seen in patients with, this is not consolidation within a cavity, okay. So this is, you know, there is a consolidation. Within that consolidation, a cavity formation occurs within a consolidation. And after that, you know, in that cavity that had developed due to tuberculosis, okay, there is infection by this fungi, okay, infection by fungi, which results in ball formation. So this is not consolidation with cavity, ठीक है? देख लेंगे, right? Give me thumbs up if this is clear. This is not consolidation within a cavity, this is ball formation within a cavity, ठीक है? Then guys, you should be aware what is halo sign. Guys, halo sign is seen in angio invasive aspergillosis, okay. Halo sign is seen in angio-invasive aspergillosis. So guys, what happens? You will see a central area of consolidation, and surrounding that consolidation, you are going to see ground glass opacity, okay. You are going to see ground glass opacity, ठीक है? Guys, do you know why does this ground glass opacity occurs? Why does this ground glass opacity occurs? Anyone who can tell me why does this ground glass opacity occurs? In a reverse halo sign, okay, you are going to see, in reverse halo sign, you are going to see a peripheral consolidation, and within that peripheral consolidation you are going to see ground glass opacities. Okay, so that is seen in cryptogenic organizing pneumonia. Cryptogenic organizing pneumonia. ठीक है. Halo sign में that is not due to inflammation. The very good. Okay. In ground glass opacity it is due to the pulmonary hemorrhage. Pulmonary hemorrhage. ठीक है. So as you understand by the term angioinvasive, so what happens? Your aspergillus, it invades your vessels, and it results in inflammation within these vessels. ठीक है, inflammation हो जाती है and it results in hemorrhage, right? So guys, let me tell you few things about the Unacademy Plus platform. Okay, so guys, I would request you that you guys download the Unacademy learning app. ठीक है, so ठीक है, you download the Unacademy learning app. So we have a lot of toppers who have done well in the using the Unacademy learning app. ठीक है, a lot of toppers, they have done well using the Unacademy learning app. So in the FMG exam, so next time you are going to see a lot of toppers in the NEET PG exam as well. A new offer is going. So the new offer is that you will get a 10% discount, a 20% discount if you use my code Dr Himanshu Live. ठीक है, and let me tell you why, this is a very good thing that is very helpful for you. ठीक है, so guys, we are starting this NEET PG 2022 MCQ discussion batch. It has started on 27th January. Okay, so in this batch, guys, what every teacher, they are bringing up very important MCQs that will be helpful for you. Okay, in order to revise the important things, ठीक है, that has to, like if you are weak in some subject, okay, you can definitely go for these things, you can definitely go for those subjects. And if you are in final year, okay, if you are in final year or third year, okay, you can go for this iconic subscription. So what is this iconic subscription? In this iconic subscription, guys, you get both the subscription of the prep ladder as well as you get the subscription of the prep ladder. ठीक है, that is what is the benefit that you are going to get if you go for the iconic subscription. ठीक है, and guys, I feel the advantage of the live classes is that you can get your doubts cleared with your teachers there and then itself. That is the main advantage. So that is why you should always go for this iconic subscription, in which you will get both the recorded lectures as well as live lectures. ठीक है, then you also get 25,000 plus question bank. Okay, high yield clinical question bank that is helpful for your NEET PG preparation. Okay, it is based on the latest exam pattern, and it includes your detailed explanations. That is also you are going to get. Okay, and this is the ultra fast revision batch. Okay, if you are preparing for NEET PG, you should definitely go for this. You should definitely enroll for this batch. ठीक है, so guys, do follow me on the Unacademy learning app. Do subscribe our channel, Unacademy NEET PG learning channel. Okay, and guys, we will meet again. Bye bye, take care, and guys, keep working hard, right?